everyone, and welcome to our Monday Minute. Today we're going to discuss in part the government shutdown as it relates specifically to issues with home health and hospice. The face-to-face requirement for both home health and hospice has had a waiver allowing both home health and hospice to have face-to-face encounters conducted via telehealth since the public health emergency back in 2020. They have continued, even though the public health emergency has expired, to extend the time period for the allowance for telehealth face-to-face encounters. The expectation was that there would be yet another extension of time, possibly through December 31st, if the legislation to balance the budget or to approve the budget for the government for 2026 were to have been finalized by September 30th. That did not occur. So that means any face-to-face encounter where the date of service for the face-to-face encounter was October 1st, 2025 or later, this must be an in-person face-to-face encounter. And this is true for both home health and hospice. There must have been a face-to-face encounter for home health purposes in a facility in which that facility transferred the patient directly to home health or referred the patient directly to home health by the certifying physician that will be signing the home health care plan, or by a nurse practitioner working in conjunction with that certifying physician. If a nurse practitioner or other non-physician practitioner that's allowed in your state to certify home health patients are signing your home health certification, then there must be a face-to-face encounter by that practitioner unless there is one available from a facility, again, in which the patient is directly referred to home health. For hospice purposes, it must be a medical director or physician member of your IDG or a nurse practitioner who is an employee or a volunteer of the hospice. Nurse practitioners conducting face-to-face encounters cannot be contracted. So, again, just to emphasize, the face-to-face encounter, where the encounter itself is dated October 1st, 2025 or later, at this point must be in person. Face-to-face encounters cannot be done via telehealth. Now, if they do extend the deadline in the legislation that they finally get passed for the budget, we will have to go with whatever time frames they have allotted. We do not know and do not expect, honestly, that they would apply that retroactively. So it likely will be some date in the future going forward through whatever extended time they allow, if it winds up in the legislation at all. In addition, as a result of the government shutdown, you also may experience a slight delay in payment. The payments were supposed to continue, even though there was some mention of a 10-day holding. There's already a 14-day holding on home health payments, so you should not see really a hiccup at all with the Medicare MAC processing payments. Lastly, to mention today is surveys. If it is a recertification survey or a newly Medicare certified agency survey, home health or hospice, there is every expectation there will be delays unless your survey is due to be done by an accrediting body such as ACHC, CHAP, etc. The accrediting bodies, we understand there will be no delays in their survey protocols, but if you are waiting for surveys by your state survey organizations, we definitely expect delays until the issue with the government budget is resolved. If Healthcare Provider Solutions can help in any way to assist you in preparing for survey, or if we might assist with your full understanding of the face-to-face encounter requirements, we would be thrilled to help. Please don't hesitate to reach out and have a fabulous week.